Thank you, Dr. Clark and Dr. Hodge, for including Carol and I and our Nels Project Foundation in today's class at UCLA School of Nursing Healthcare Policy course. As you step up as leaders in our healthcare transformation, we share our family's story of faith, love, and commitment to make healthcare safer for all.
We're so excited to be here to share our journey of patient and healthcare worker safety and the health policy successes we have led after learning the hard truths about inadequacies that are fixable within our nation's healthcare system. Many of these areas will focus on preventable medical harm.
Our goal today is to empower you with awareness that you will never forget so that you'll be prepared to be leaders. And number two, share with you a roadmap in our healthcare policy changes to save lives. And three, celebrate you all for the exciting career change that you are about to launch.
And I never like to waste a moment to say we're here honoring our son, Niall Calvin Moss, who lost his life at the age of 15 to preventable harm, and we're here to make things different and to make healthcare safer.
People say you have to have a lot of passion for what you're doing, and it's totally true. And the reason is because it's so hard that if you don't, any rational person would give up. It's really hard, and you have to do it over a sustained period of time. So if you don't love it, if you're not having fun doing it, and you don't really love it, you're going to give up.
Now let me take you on a journey through my mind's eye and just imagine a life that feels so right. Well, you ain't gotta worry about finances, and I ain't talking race. I'm just saying you ain't broke, and now this ain't a joke.
Hello to all of you. This is Carol Moss and my husband Ty Moss, and we're so thankful to be here. Thank you so much for inviting us, Dr. Clark and Dr. Hodge, for today's policy class at UCLA School of Nursing. We're so excited for all the students, and we're hoping that we can meet our goals today by sharing our story and empowering all of you with awareness that you will never forget as you prepare to lead. We want to highlight details about a roadmap to safer healthcare. You can lead life-saving health policy yourself as well. And then last of all, to celebrate all of you, because you're all awesome and superheroes, and we can't wait to see all the things that you'll accomplish in your new careers in nursing. So let's get started. As I mentioned, we share our story, our advocacy journey, celebrating our son, Niall Moss. There he is in the pictures, my husband Ty, myself in the middle, and Niall. Our family story is built around faith and the love and commitment to make patient safety a focus for our nation's healthcare. In 2006, we were unaware of so many things that touched our family's lives that we were not prepared. We were not prepared to protect our son in a healthcare environment for the things that he was going through, and we were not aware of the challenges that we later learned that we're going to share with you today. So here's some pictures of Niall. I'll have to forgive myself because I've peppered them throughout the whole presentation, but Niall is in the top right-hand corner there with my sister, his Auntie Sherry, and Niall was born with hydrocephalus. He had water on the brain, and that picture was right before we discovered. He was born, he's probably about 8 days old right there on the right. We later had an incident where he choked and turned blue, and we had to rush him to the emergency room and then get him to the doctor, where they began to do all the measurements they do with infants. And we learned pretty quickly that his head was growing too fast. And with an MRI, they determined that Niall had aqueduct stenosis. He had water on the brain. There was an aqueduct that was blocked with something, and they needed to fix it fast. So we found an incredible surgeon. We've been blessed with great physicians and nurses throughout our lives. And Niall began a journey that required us to be frequent flyers of the healthcare system. So Niall, as you can see in the picture, he's so cute, and he's got a little bit of strabismus, a little crossed eyes, as you can see with his glasses. So off and on, Niall needed to go to the hospital and have eye surgery and neurosurgery. And at his school, he started school at 3, and he needed to have occupational therapists come into the school. He needed to have physical therapists, speech therapists. He needed extra special help, but that's why he started so early, so that he could get ahead of it, because oftentimes with children that have had brain issues, I'm sure you're aware, they have developmental disabilities, but Niall overcame all the odds. Here he is in Marbella, Spain, on top a picnic table with his best friend Jackie, and they're dancing and singing, doing their thing, because he overcame everything he was given at birth and just became a wonderful young man. We share this story of Niall to inspire a new culture of truly safer healthcare, and we are so honored to be here to share this story with you. So Niall needed to go to the hospital to have a series of tests in 2006. Each year, Niall would have an MRI. He would have a bunch of different tests, and they would check to see if that growth in his brain had grown. He had a shunt, and so they would always check to see if there was enough tubing in there, and the spinal fluid would drain into his abdomen, and they needed to check that with an x-ray. So this was after Niall had not had any operations or surgical things for about 5 years, and he simply went into the hospital for an MRI and some tests. And days later, Niall had flu-like symptoms. He started wheezing, he had a fever, and so this happened to be Saturday, the day after Good Friday in 2006. And so Saturday, we took him down to the kids doc, which is an after hours facility attached to the hospital. This is in Orange County, California. And they tested him for strep throat. And I told them, he'd been in the hospital. This all happened right after the hospital. He never gets sick like this. And they said, well, just go get this prescription. So they handed me a prescription that turned out to be useless. They had tested him for strep and it was negative. So this would have done no good. And that night his fever went to 104.5, and it was frightening. We were able to get him a cold bath and his fever went to 99. So the next day now is Easter. He wakes up wheezing and struggling to breathe. And so we rush him back down to the hospital and the doctors. And it took forever to get an x-ray. And then the x-ray showed that he had necrotizing pneumonia. And then it took another 5 hours, and he's wheezing and not even getting any help to breathe. For 5 hours, they finally admitted him emerge into the ICU. And then it took another 5 hours for a single drop of antibiotics, of wheezing and struggling to breathe. And it was so hard and it was so horrible. And I can feel what people are going through today with COVID and the challenges that they're dealing with, because these were the same signs that we hear about today. Niall couldn't handle everything. His heart gave out. He was on a ventilator for a very short amount of time. And Niall ended up dying that night because he wasn't treated quickly enough. We learned days later, when I was called by the emergency doctor, that they had taken a test for MRSA, methicillin-resistant Staphylococcus aureus, just hours before he died, and the test came back positive. And so we had no idea what is that. And so I went to Google and I typed in, methicillin-resistant Staphylococcus aureus, and 2 things came up. One was there was a rapid test for MRSA available, and it was a 2-hour test. And I said, oh my gosh, a 2-hour test. This test that they took 3 days. And so then there was also a woman by the name of Lisa McGiffert who ran a campaign called Stop Hospital Infections. And I said, what is this? So I called Lisa McGiffert, and she began to give me a PhD And our relationship has continued now 14 years on the problems and the realities of what happens in hospitals and what continues to happen as it relates to preventable medical harm, and specifically in the areas of hospital-acquired infections, preventable hospital-acquired infections. So this is a journey of what we have learned over the last 14 years. And it is troubling, it is truth, and it is important that we share the truth, because we believe that the truth is hard, but it's what you do with the truth that makes a difference. So in honor of Niall, we're sharing the story, and we're thankful that you're all here to hear what we've learned. So when we learned this, we went ahead and said, we have to do something, because we were unaware of the problem of hospital-acquired infections, and we were not prepared to protect our son. So we did research, and we found out that there's many steps that you can take to prevent infections before you go in the hospital to prepare for it. We learned from the CDC. I made a phone call and I said, how come I made 9 appointments. I said, I need to meet with you at the CDC, because I'm learning that these infections have been in hospitals for decades and they're preventable. And so they began to educate me on the preventative measures and the science, and that, there's ways to prevent these things. However, healthcare facilities and hospitals are not required by law to follow the CDC guidelines and best practices. And we said, red flag, that is a big deal. We need to educate the public about this, and we need to find a way to make the CDC guidelines mandatory, because today they're optional. So we launched Niall's Project, and Niall's Project was built it started out with Niall's family, our friends, and my husband has been in music all of his life. And he's written for Carlos Santana, and he played with the Temptations. So it was natural to say, let's bring on all of our artists that we know, and let's start doing some awareness concerts. So this picture right here is an awareness concert that we did out at Saddleback College in Mission Viejo, and it was called A Night for Niall. And we're doing much like what we're doing today, sharing Niall's story, educating the audience, but we mixed it up with a lot of great music. And we are a coalition to stop unnecessary deaths from preventable infectious diseases. And we do this through awareness. We do this on Drive Time Radio. We do it at the fairgrounds. We'll hand out 15 steps to prevent infections. We'll do it anywhere where people are listening, because we think awareness is what is going to help us make change. So as we provide this information with you, we want you to know the things that we learned. And we learned that medical errors and hospital-acquired infections kill up to 440,000 Americans every year. And these are preventable errors. Not only are they errors like during surgery, tools are left inside of patients, but there are things like, people are operated on the wrong arm or the wrong person. But in this particular case, we are focused on preventable hospital-acquired infections, why this continues to harm so many people. So here's the facts that we uncovered. Hospital-acquired infections on any given day, 1 in 31 patients go into hospitals and contract at least one preventable hospital-acquired infection. And this is from the CDC prevalence data in their report that was reporting in 2015 data. The total number of preventable hospital-acquired infections were 687,000 preventable infections, and 72,000 of those people died, and that's a minimum. These measurements don't measure outpatients. They only measure those people that went into hospitals and spent the night. This is information that we could not believe. And this is more recent data. The numbers were much worse then, because this has become a focus, but it is still a major problem, and we need to find a way to end it. But back in 2006, I was appointed by Governor Schwarzenegger after taking the advice of Lisa McGiffert from Consumers Union that said, if you want to make some change, you need to get on a committee that's doing work, that's preventing harm, and you need to speak up for the public. So I took her advice. And since then, I've been supporting and a voting member for 9 years. And now I'm a subject matter expert on the Hospital-Acquired Infection Advisory Committee for the state of California. I was appointed by Governor Schwarzenegger and then again by Governor Jerry Brown. Today, I continue to work on subcommittees that address antibiotic stewardship, antibiotic resistance. They address public reporting and education. And the most important one that I feel is environmental cleaning. And today I want to share with you how we were able to implement new legislation in the state of California and actually accomplish 2 laws that went into place within a year. So we became very educated on how these infections can be prevented. And then we became familiar with what was happening in California. So we found 2 senators that addressed this for us. The first one here that you had been given the link to go ahead and watch this hearing. This is a California State Senate hearing led by Senator Dean Flores, the chair. And at the time, it was when we gave the data to the state about superbugs, about MRSA and what was happening in 2007. And Senator Dean Flores was always very good about getting these things on the record. And so he let us help fill this hearing with data. And he went through layers of the California Department of Health, the labs, all the people that would need it to find out, is California prepared for a superbug outbreak? And when you go through this hearing, you'll find out that definitely not. They were not ready then, and they're still not ready now. And you can see what's happening with the coronavirus. To us, unfortunately, we are not surprised because we've seen what's been happening in real life, not in public. And so now today, we are all starting to hear and see what happens when everything is not necessarily upfront. So Senator Dean Flores did a wonderful job. And if you didn't see that, you'll be able to watch him interview the California Department of Health to ask, well, how many people have MRSA in California? And pretty much they said, we don't have an idea of the total count, and they still don't have an idea of the total count. So our goal was to bring transparency. These are the things that we identified that we had challenges with. And these are the names of the bills that we started, SB 1058 Allquest and SB 158 in California. We actually wrote the first iteration of SB 158 and before it went through the process. And SB 158 we assisted with. So these are the things that we felt were important. Public awareness. We needed transparency. We needed public reporting of hospital-acquired infections. We knew that hospitals needed to follow best practices and proven practices by the CDC, and they weren't. And the VA had reduced the spread of infections within their system by screening patients and other things as well. So we included screening in the legislation. And many hospitals didn't have any kind of even a infection prevention protocol or a program. So the legislation mandates licensing and certification for the state of California to go out and make sure that every hospital has an infection prevention program and to illustrate and demonstrate how they follow their program and their success or where they need help. And last but not least, environmental cleaning was rarely included in the FEMS, the federal CMS surveys that happen once every 3 years. And so we included environmental cleaning requirements in our legislation, just to name a few things. We are all focused on creating a system that's better for all. So, what you need to do is you need to find like-minded people that think like you, and that's what we did. We went to the public. We found people that had been harmed. We found survivors of people who their family members did not survive from hospital-acquired infections, just like Nile, and we began to attend the hearings, speak at the hearings, be a part of everything around to make sure people were aware of what was happening in these hospitals. And so our legislation was launched on January 1, 2008, and that was Senator Elaine Alquist. That's my husband and I, and the picture of Nile. Proposed state law targets deadly staph infections. The staph infection is MRSA. They never wanted to call it that. And so, long story short, what you're looking at on the right side there is the all facilities letter that requires the implementation of what we had in our legislation. Results matter. And no matter what you have to go through to get the results, in the end, what is really important is that these all facilities letters go out and that they are correct and that they are requiring what the law demands. And I'll go ahead and provide what the legislation is to Dr. Clark, and that way you guys can take a look at the specifics. So in addition, this legislation required every hospital to report their infection rates for MRSA, C. difficile, VRE, and also to report it to the public. So this is the website, the california.gov website, where you can actually pull up a map, click on a hospital, and find out how they're doing with preventing infections. You can also compare and look at historical data. And so we were so honored that they named the legislation for SB 1058, Niles Law. It is also the California Hospital Acquired Infection Prevention Act for facilities, healthcare facilities. And it has been a lot of work, and we've needed to keep an eye on it because many hospitals have tried to go around it. Even the California Hospital Association has tried to go around it, but we've been able to monitor and make sure that everything is upheld. So these are some of the key findings that I mentioned, the CDC guidelines that know how to prevent infections. They know how to control these infections in the public. They're not mandated, they are optional. And so that is where there's a big problem. And then also we learned that the CDC the CDC does not enforce best practices because that's not their job. They're the science. So this is where there's another big gap. Who will enforce these guidelines? And so our goal is to find a way to make the CDC guidelines for infection prevention a mandate if you want to practice healthcare in the United States. We also found out about Nile. What actually happened with Nile is that he went in to this hospital, which is the top children's hospital in Orange County. He acquired MRSA from unclean surfaces on the MRI. This is what caused the infection in his body that ultimately led to sepsis. We were working with the CDC to start educating the public on sepsis because we found out that over 1.7 million people get sepsis every year, and 270,000 Americans die every year from sepsis, from delayed treatment, just like they did to Nile. They did not take the signs of sepsis seriously, even after being told he was just in the hospital where you can get infections, where it's obvious that there's MRSA is very prevalent in California. And then we learned that 1 out of every 3 patients who die in the hospitals have sepsis. So we focused on and continue to focus on educating the public about sepsis and how time matters and how quickly you need to respond. So this is another attachment that you guys can take a look at, this video where we started working with the CDC to share Nile's story with the world as they continue to focus on sepsis awareness. We wanted to share this information all around the nation, so we started on road trips. Improvement, we were invited to Connecticut and Rhode Island to go out and speak with healthcare professionals, talk to the Connecticut Hospital Association, educate them on sepsis awareness to make sure that these healthcare workers really understand the importance of understanding what the signs of sepsis are. Do they look sick or do they not look sick? There is a definite sign of sepsis. And these are the healthcare workers that we were training in Connecticut, where Ty and I are in the middle. You can see us and the trainer. And so these are healthcare workers that are catching up on their training. And we always have a robust question and answer initiative throughout the entire meeting. And by the looks of it, everybody looks pretty happy. We're doing double thumbs up because that's what Niall always loved to do. So they were honoring Niall for that. I really appreciate it. So we can fix this together. And that's why we're sharing this with all of you. We'd love to continue to keep in touch with all of you because we are patient advocates and we can speak for you. There are times that we have found, the CDC sends us places to speak. They don't tell us what to say, but they know what we're going to say. We're going to speak the truth. We're going to ask for things that we need. And so there's always times within a career that you may have that you're not getting the help you need. So our contact information is on the back. You can reach out to us and we'll do things anonymously. We are all focused on patient and healthcare worker safety. This just is a note to say, we have known how to prevent these infections in healthcare facilities for decades. I note a SHEA, S-H-E-A guideline volume in 2003. They did a complete report and study on how we've known how to prevent these infections for over 30 years, yet few hospitals refuse to implement the total implementation of infection prevention best practices. The other thing that we've learned that we did bring up before is that transparency is the only way to fix the problem. If you don't have a baseline, if you don't know where you're going and you don't know where you are, you can not measure success. So this is a recent article that we wanted to bring to your attention about the coronavirus and the efforts for, kind of the perennial tug of war between privacy and transparency in the United States. None of us want to know who individually has these viruses, but we want to know what is the prevalence of it. And we also want to know as individuals, do we have it? Have we had it? And these are things that we really need before we can come back together and have a world of togetherness again. It's a very challenging time. But one thing we did notice and have been fighting for more than 13 years is that diagnostic test that I shared with you, the rapid diagnostic test. Over these years, we've realized that physicians refuse to allow you to be tested in so many cases. We've learned that from physicians that testing patients for MRSA, you can get reprimanded for doing that within healthcare systems because it's just something they don't do. And so what we've learned is it's so weird that it's so hard to go and test. We had this one woman who worked in a senior citizens facility and she was going to start doing daycare and she wanted to be tested before she went and started working with children and she couldn't find a single person to test her. And the same thing happens when someone's been to a nursing home or you've been to a hospital and you just want to make sure you're safe to go home and physicians refuse to test. So we realized a long time ago that the public and healthcare workers need to have access to rapid self-home tests that are accurate, available, and that the government has approved so that we can all test ourselves. I mean, in the case of Niall, if I had a rapid test at home and I could have found out that he had sepsis, or days earlier I could have checked him for that fever if he had a respiratory problem. These tests are excellent when you have respiratory problems to find out, is that respiratory infection caused by a virus or bacteria? If it's a virus, test it for a COVID-19 test. These are the things that we have always needed. And now you can see that they are out in the open. And this is where we need to fight for ourselves because we need to empower ourselves and healthcare workers so that we're protecting our families and we're protecting those who we gather with. We don't want anything fancy. We are fighting for things that are just like tests that you can get to find out if you're ovulating or if you have a urinary tract infection or if you want to find out if you're pregnant. We're not looking for anything just exotic. So we began at the top and we went right to the CDC and we worked closely with Dr. Frieden and said, please help us. We are advocating for self-home rapid tests and we'd love the CDC to help us make one that is accurate, affordable, and available for all, simple to use and approved. And he was very helpful and he sent me right to the White House. This is at the White House when President Obama in 2015 launched the first antibiotic stewardship forum on antibiotics at the White House when they began to focus on eliminating antibiotics from food. And there were manufacturers, there were pharmaceuticals, there were those who made tests, there were McDonald's, and all different kinds of people who are using antibiotics within the products that they deliver. And I stood right there at the mic and impressed upon everyone in the room, and it was also representative of every single agency in the United States, the importance of empowering the public with self-tests. And so, I always like to throw in some more pictures of Niall. There he is up there with his horse, and we're together with this horse text there. Some great memories. So we continued our road trip. This is at the Capitol in DC, where I made the case in front of about 50 staff members for Senate and Congress, and telling them and impressing upon them the urgency of rapid home self-diagnostics and point of care for physicians as well. We have continued to educate ourselves and be a part of different events that take place that are international, because we're looking to see what are they doing in other countries. And they do have tests like this that are available that are what will it take to impress upon this country to empower the public with their own testing. The challenges at hand are scary, but we can overcome this together. But we need to do it together. The COVID-19 makes the case for at-home and rapid tests, and we urgently need self-testing. As you've heard in the news and everywhere else, we are so focused on finding a way to implement this government-wide. So that is a new way of educating the public and empowering the public so that they can have a greater participation in their healthcare. You can't, as I mentioned before, you can't fix the problem if you can't see it, and without true testing and surveillance, we are operating blind. So I'm going to leave you with this question and the end of part 1. I thank all of you for your time, and we'll be back with part 2.
Was a young man who didn't live a long time, but he was mighty special, y'all, the son of some friends of mine. He had a smile on his face and made everybody happy.
Hello, we're back for part 2 of Making Healthcare Safer. And we want to start with the section of how we can share a roadmap to safer healthcare. You can lead life-saving health policy changes too, and let's show you how. So here are the key initiatives that we found for policy development. You need to organize to change culture. It's so important to understand where you're going, so you need to have a roadmap. And how we were able to be successful is we identified the problem and we found the solutions. We have proved out the solutions, and now you need to make sure the solutions can scale. You need to consult with experts and find your advocates, all of the people that agree with you. You'll find them in all different places. You cannot do this alone. You can start it, but you definitely cannot do it alone. You need to write your own proposed bill language as the first draft. Don't wait for somebody else to do it. You write it, and you make it as big as you can imagine, because you need to leave room for negotiations, because there will be negotiations. Then you need to tie the funding of any fees that will need to be approved in appropriations to some kind of ongoing fee. So any funding costs tied to ongoing fees. In our legislation, we tied the support of the HAI Advisory Committee, the reporting, the data management, the website, all of that is tied to a per bed fee, so that we won't ever get hung up again in budgets. As long as there are hospital beds, there are fees tied to each bed, and that way it pays for this patient safety legislation that are now in the regulations. Also, educate the public and your coworkers however you can and make them aware. Be really creative. The picture at the bottom is that HAI advisory committee that I shared with you that I've been involved in for almost 14 years. And this is an organization that you should take a look at. You need to be a part of the decisions being made at the table. And this is where you learn. This is where you learn, and this is where you can add your expertise. So make this a goal to get on committees, get a voice, get a vote. Get on these advisory committees and make sure you have a vote and a voice. Then learn how to lobby. You will definitely need to learn how to lobby. You will need your legislative leader to represent you. There are staffers that will guide you. And it only takes one yes. Don't leave the room unless you have shared your proposal and you get a yes. And if you don't get a yes, keep coming back. So as a part of our education and promotion and sharing information, we make sure that we participate wherever possible. On the left at the bottom, that's Charles Ornstein from the LA Times, a Pulitzer Prize winner. And he invited me to speak at this event in downtown LA about public reporting. And it was a very lively conversation, and it really did make a lot of noise, and we made lots of progress there when we talked about educating the public so that you have the tools that you need to make decisions on what healthcare facilities you want to take your family to, and it's the same for you as healthcare workers. Study the hospitals before you go there. Find out if patient safety is a priority. If they focus on educating every single department on what is your infection rate, what is your preventable harm rate, and what is your goal. These are the questions you need to be asking them because you are valuable. Healthcare professionals are valuable, and you deserve to be working in a facility that puts the patients first. And so we also had a really lively conversation at South by Southwest when Consumer Reports, that's Lisa McGifford on the right, who I told you was who I started working with years ago on her Stop Hospital Infection campaign. When she worked for the Consumer Reports magazine, the public wanted to find out is there a way that we can post our infections and the reports are public and we can share data that way, because we know we're not getting the facts. And so this discussion was around, if we had a portal somewhere where each one of us could post our proven diagnosis that you have an infection and that you received it at a certain facility. This was a lively conversation about what needed to be included on that report. And we found out that everyone wanted real-time reporting. So I could look at it like the Superbug or the bedbug portal that you can go to bedbugs.com to find out what hotels have bed bugs. We felt, okay, there was a whole audience that was talking about maybe we need something like that in real time. What hospitals are having outbreaks? Where are people getting infections? And then on the other flip side, who's doing a great job? What hospitals do we want to go to that have turned around their infection rate and then high scores on patient safety? Always do public awareness. This was a really exciting day at the Capitol of Sacramento, where I believe it was the day we had all the posters and everything out, but get the public involved. They need to be educated and they need to be a part of the solution, and we need public awareness, so public outreach is key. These are 15 steps you can take to prevent infections in hospitals, and you can get to those brochures and print them out on our website at nilesproject.com. And there's also 10 steps to prevent infections in schools. This article I wanted to share with you was the result of a healthcare worker that had told another patient safety activist that I don't know why, but we're having so many, they're testing us for MRSA, and it's really concerning me. So we investigated it, and we uncovered the fact that this young mother had just had her baby at this hospital, and he was the 10th baby to contract MRSA in the NICU. So, we work with hospitals. We try to do whatever we can to give them information. And then when we can't get anything to work, then we put it out there. We make sure that we have the facts and we disclose the information so that the healthcare workers are protected and these mothers having babies are protected and everyone in the hospital is protected. We believe that there should never be an outbreak happening in a healthcare facility where people are still registering people at the door. And in every case, if there is an outbreak happening within the facility, those patients have the right to understand that there is an outbreak, and that they have the option of going to another hospital. But in this particular case, this child, this preemie baby, was inflicted and was infected in a NICU where 9 other babies had contracted MRSA. And it was absolutely just mind-boggling why nothing was happening to clear this up. So these are some of the things that we do in patient safety, and we will keep whoever has shared this information anonymous. This is some of the things that we're doing with the CDC in working on the appropriate use of antibiotics. The other part of the roadmap is make sure you educate the public and your co-workers and make them aware. Be creative, get them involved, make sure they're a part of all of the things that you're doing, because people love to be a part of making change, and especially in improving our healthcare system. Make sure you've got your buddies together to fight for and educate legislators. We make sure that we know how to get to the point, explain the information, and make sure that every staffer understands that our topic is the most urgent and that it's on the top of the desk of the pile. Many of these staffers in these legislative offices have 20, 40, 50 proposals on folders on their desks. You've got to find a way to get your proposal and your request to the very top and always keep it on the top. So you've got to completely add pressure. These are groups that we work with, the Patient Safety Action Network, and we had to actually go back in and protect Niles Law. So that's what those signs are for, honor Niles Law, as the hospital associations fought back as new parts of the law were implemented on reporting of surgical site infections and other areas as well. So be ready to continue to fight for your law even after it goes into the regs. Now, you'll have a chance to take a look at this if you haven't already. This is one of the concerts that we do, and it has a little area in there with Lisa McGiffert introducing the staffer that worked really hard with us on our legislation, Robert McLaughlin, and also a couple other ones that attended the concert. This is another one of the concerts that we did here at Jordan High School. This was their 75th anniversary, and we joined in to make this a Night for Nile and public service announcement to educate the public on MRSA awareness. So we had a contest where part of the grade was included with a PSA commercial and then a poster, and this was the award-winning poster as it relates to how to prevent contracting MRSA, and the artist was great, and they were able to win an award at the concert that night. So this is another one of the concerts that we have done at Saddleback College at the Fine Arts School, and you can take a look at the link below and check that out, a Night for Nile awareness concert. So we always make sure we consult with our patient safety partners on the right. That's Dr. Frieden from the CDC, Lisa McGiffert, and our leader at the CDC that really made sure that we the patients were being heard. And so these are a lot of our good buddies and friends that we've worked with and that we're standing in front of the CDC as well. So I wanted to point out this picture on the left, the top left there. There's 4 of us, Lisa McGifford, myself, another gal there. But the one at the far left, she's the one who taught me how to lobby. When it looked like this legislation was really going to happen, you need to go and educate each lawmaker. So she said, meet me in the lobby 9 o'clock sharp. And I had a rolling bag. She said, get rid of that rolling bag. Here's where all the legislators are. You take all the Democrats, I'll take all the Republicans, and go in and talk to them about what it is they need to do, and don't leave until you get a yes. And what was so great about Beth Capel here on the left is she said, this can definitely happen. She said, I was the one that worked really hard on lobbying for rubber gloves. Remember when there was a time years ago that nobody would wear rubber gloves and nobody would pay the price. But once everybody is required and they show the reason why and there's justification, the cost is not even a problem because it's so mass produced that it's like a moot point. So now rubber gloves are definitely the best practice, and that's what we want to do about rapid testing or self-testing and awareness and all the things that we're working on today. So I really owe my experience to Beth Capel there on the far left. She was awesome. And here we are with other legislators up in Washington, D.C., and just fighting for the causes that we are most passionate about. These are our bioengineers. We found experts. You've always got to find your experts. They are, they worked in hospitals where they clean the equipment for 30 hospitals. And when we explained what we were doing, they said, oh my gosh, we've got to work together because we know where the messes are. And so our question is, why are they not cleaning? And now we have bioengineers to help educate for cleaning. And that's when I started the environmental cleaning subcommittee on the HI advisory committee. And you've got to have a seat at the table. Our focus, coronavirus transparency, pay for performance versus fee for service. This is where our healthcare system is driven by the number of procedures as compared with being paid for the quality of care. We're passionate about that. We work on infection prevention, preventing outbreaks, antibiotic resistance, sepsis awareness, C. diff, CRE, VRE, and MRSA awareness, the urgent need for rapid diagnostics, environmental cleaning and monitoring, and the death certificates that have no rhyme or reason. This is the CDC, and we are with a room full of patient advocates, and we have a seat at the table with Dr. Frieden and probably just the same number of CDC science experts as we share personal stories of harm and share the solutions that we're looking for, and we get their advice on how to try to make it happen, and then we work together to try to make healthcare safer for all. Oh, more pictures of Niall. So up there making pancakes, hanging out with Chip, and Dale, and a night at the Grammys. Question number 2. Go ahead and answer that question, and we will pick up at section 3. What's the number of estimated COVID-19 cases in the U.S. on May 4th, 2020? And how many of those patients died of the coronavirus on May 4th, 2020? And we're back, part 3. This is my favorite part. We're going to celebrate with all of you. We're so excited for your upcoming careers, and we just want you to know that we're happy to help in any way. I know you're excited. You probably have questions. I'd be happy to answer any questions. We know we're all in this together. We're so thankful for our nurses and all healthcare workers on the front lines. We couldn't do it without you. These pictures that I've kind of peppered throughout the presentation are all from my probably 2,000 nurses that I have on my Facebook. So many of them are in the middle of what is happening now in New Jersey, New York, all over the nation. We pray together. We are, behind each other. We're rooting for them. And just like we're rooting for you, we want to give you the message and give you our just congratulations and share with you the importance of always advocating for what is right for the patient. If you're not getting the help you need from coworkers, seniors, people you report to, find a patient advocate. There's our number. We can help you, because there is no reason that you should ever put anything before true patient safety. It's so exciting to know that you will soon be a part of a care team, maybe at the bedside for someone's mom or someone's son, for someone's daughter or wife. Always follow your spirit and your expertise so you can live with your soul. There's nothing better than knowing you did the right thing. We've worked with producers and we have had an excellent experience working with the producers and directors of the show called The Resident. And the show is educational and it is entertaining, but it is real life stories. I've always said, I'm so proud of this group of producers that have, and all of the cast that have put together a very difficult show that educates you with real, true stories of preventable patient harm. If you want to be knowledgeable, if you want to be prepared for real life, watch That Resident. It's still on, but the season's almost over, so you can watch it on Fox Now or Hulu season 1 through 3, and you will be treated to some really good production and some truths that you will not believe. But we're so thankful to have been here with you. These are the nurses that every year at Mission Hospital, they celebrate every single patient, child patient at CHOC, and they're so wonderful. Every year they do a memory event, and I just wanted to tell you a little bit about them. But here's our contact information. I've left you with resources and more information for you to read on your own. We wish you the